Welcome to Ethio EMR, Ethiopia's multi-tenant electronic medical record platform. In this short guide, we will be exploring how to process drug and lab orders in the platform. We will go back to the patient summary on the patient chart under the Ethio EMR platform. On the right hand side, we will find navigation buttons. We have seen the clinical forms in the previous video. Now we will go to the order basket and we will be able to see drug orders, lab orders, imaging orders, and procedure orders. When we want to prescribe a drug, the doctor adds a drug for the patient. The doctor can search for the name of the specific drug that he or she wants to order. Over here on the top, allergies can be seen so that the doctor can know what allergies the patient has while making the order. When we click on the order form, we will find the details of the order form. We'll find the dose to put, the routes, the frequency. Any instructions can be inserted here. When the prescription has been made, for how many days the patient should be taking, and if there is any refills that are needed. We will click save and order. We have to insert dispensing instructions as well. Once we save the order, we click on sign and close. We will get a notification that the order has been placed. When we go to the Dago platform, which the pharmacist will be viewing, that patient will appear on under dispense. Here under dispense, you will see our patient has been given an order. Therefore, the pharmacist dispenses the drugs as per the doctor's prescription. However, the pharmacist has the option to edit if there's any information here that has been pulled. As you can see, all the data has been pulled from the ETOMR platform into the Dago platform. Payment options can also be edited here. Different options for editing are here, and also if there is any issues such as DTP or drug, if the patient needs additional drug therapy before taking this drug, the pharmacist can insert that based on his information. Then the pharmacist, instead of dispensing, can reject the prescription and will be returned back to the Ethio EMR system. When we go back to the Ethio EMR system and look at the different orders, since it was returned, it will not show us under the orders, but if we come to the patient summary, we will see that the drug has been discontinued. If the pharmacist had dispensed the drug to the patient, we will see that the order has been processed. So the information is connected to the DAGO, and data is flowing between the two. So in this instance, we see how drug orders are made. Next, let's look at lab orders. Again, we come to the right-hand side and we can add a lab order here. Here, the doctor has an option to scroll and look at all the available lab tests available, or the doctor can search up here what he wants to search for. In the order form, it shows if we, for example, ask for white blood cells, the doctor can put options of when he or she wants. And those tests, they can add additional instructions here and save the orders. Once this is conducted, we sign and close, and we will see that order has been placed for white blood cells. Then, in order to look at the lab order, we have seen that the price has been configured and it goes to the OpenALICE system. In the OpenALICE system, if we go to orders and if we look at incoming orders, we will be able to search by the date that the order has been placed. And here we will see our patient. Once we find our patient, we will need to generate something. Here we'll find the generate button under the drop down, and we will be able to generate the order for the lab. We will click generate order, and here we will find the patient information. Additional information can be added here, but all the information is pulled into the system. Next, we will choose what in the program selection. We will choose what kind of testing it is. Is it a routine testing? Is it related with HIV or any other testing? Let's continue with routine testing and click next. Then it will give us an option to add a sample. Therefore, the laboratory technician will be able to take the sample and insert the quantity and unit of measure for the sample, the collection date, the collection time can be inserted here, and the name of the collector can be inserted here. In the order of panels, we can again choose the test, but already has been selected here. The initial order. Then if we want another sample, we can add a second option of adding another sample. Once we've done that, we click next and put in the information as to who is going to be receiving this result, then who we're going to be sending the result to via email or SMS towards the patient or any other requester that will be receiving that request. It could be any of the doctors that have been seeing the patient. Then we will get the notification that says successfully saved. Here we will, when we click print barcode, a new pop-up window opens the barcode for the lab order. Once we have printed the labels, we go back to the open layers, we go to home, and then we look at the tests that are in progress. So we can see, we can sort by date, and we can see that they are being processed. Then we click on the order that has been made, and if the laboratory technician is inputting the result manually, he or she can do so and click on save. If they are being pulled from analyzer machines, we can click on the menu and choose analyzers and go to the analyzer list. The different analyzers, machines that have been made active can be seen here, and the data can directly be pulled from there. We go back home, then we look at ready for validation, and we search for our entry, then person who is in charge of validating will validate the test, then they will click save. Then once we have validated, we go back to the ETO EMR to the patient chart to see the lab order. Once we are in the patient chart, we go back, we go to results, and we will see white blood cells results of 7 that we inserted in the opening lines, or the lab technician has inserted in the opening lines. Therefore, the doctor can get the result on the patient chart from open LIS. That concludes the lab machine order process. Other functions that we can see here on the right hand side is a visit note. A visit note is where the doctor puts the primary diagnosis of the patient. So once the diagnosis is selected, the doctor can choose confirmed or presumed. Once that is clicked, it is registered. The doctor can also put a secondary diagnosis and confirm it. the doctor can write notes here. The doctor images here and upload files, and save and close. These visit notes can be accessed under visits as different instances and provide the overall of the patient. The other function that we find on the right hand side is the transfer form. Sometimes the doctor might be seeing a patient and will realize that they need to be transferred to another department, requiring maybe specialized treatment. Therefore, if, for example, they want to send it to the neuro clinic, needs attention from neurology, and click save. Therefore, we will see the message that says form has been submitted successfully, and asks the doctor whether they want to move the patient to the queue. When we click yes and move to queue, we will see that our patient is being moved to the neurological clinic. We can enter condition dates here. We can select the time of transition and click move. Once that is done, if we go back and look, we'll get a message that queue entry has been adjusted. And if we go back to the service queue, we will be able to see the patient has moved to another queue. Let's search for our patient, and here we will see that he has been transferred coming from pediatric OPD queue to neuroclinic queue. We can also see the transfer notes here and when that transfer has been done. In this manner, a patient can move from one department to another using the transfer form. So we have been able to see the different functions here. Last, we will look at the actions button up here. Here in the actions button, we can check out, we can mark the patient as deceased, we can edit the patient details, and so on. Therefore, this brings us to the end of this session. Thank you very much.